life is strange sometimes, right? I was an entrepreneur in legal tech 20 years ago, and then all of a sudden I got a daughter that got a diagnosis at 5 months old, cystic fibrosis, and I was working in the intersection between the academia and the startup ecosystem in Stockholm. So I was there. I was at the Karolinska Institute, and all of a sudden I was also at the Karolinska University Hospital. So I kind of started realigning my life. I actually did this Venn diagram, kind of with the circles. They were apart in the beginning, but then over the years they've kind of become closer and overlapping. So I want to give you a bit of a story from my life and the source of my entrepreneurial impulse, and understanding your entrepreneurial impulse also maybe sometimes takes time. But in my case, I just had to listen to my daughter, and she expressed it a few years later. She was 9, and she expressed it so well. So we actually made a short video of it. So I'll give you that first as kind of this introduction to the source of my entrepreneurial impulse.
Jag skulle vilja hjälpa andra att förstå patienter bättre. Ibland lyssnar ni inte eller förstår ni inte allt som vi vill lära er. Jag tycker det är bra att kunna skriva in hur jag verkligen mår och tänker. Så att det finns samlat på ett och samma ställe. Det är bra att ta för att andra ska förstå, och det blir bara tjatigt om jag ska förklara allt på nytt varje gång. Jag skulle önska att ni kunde gå hem och veta mer om hur det är att vara patient.
I want to show you what I see in my dreams.
Jag vill inte ha den här sjukdomen. Men när jag ändå blir sjuk vill jag att det ska vara så lite jobbigt som möjligt. Jag vill ju bara leva mitt liv.
I want to live my life, and I know we will fly. I believe the world can change if we try.
So actually we started with that, and that video then helped the Stockholm region win a competition in the EU, and they got 40,000 euro and designated to build an app. So it kind of, we did it the other way around, starting there. But so the other thing, 15 years ago was that apps could really be a design trigger to engage the community around an app. Let's build an app. So what we did was that we developed a Genia platform. We started a startup called Upstream built on my daughter's vision. I think it was extremely cool, and it took me a while to understand what she meant, and kind of I would like to help others understand us better, get it. Sometimes you don't listen, get it, and you don't see what we want to teach you. Beautiful. I want you to go home and know how it is to be a patient. That's kind of revolutionary in a society if we understood each other, right? So we came together, patients, families, and care teams, and developed this platform. So I'm going to use the same technique. So let's look at the app as a design trigger, and then I'll dig deeper into the commons and the community building. So this is a second video for the app. Okay, still with me? Yeah. So I'm a patient data lawyer, kind of entrepreneurial lawyer. So for me, this idea of a personal information exchange, how can we have a personal information exchange that empowers me when I live with healthcare as a lifelong partner, that supports the co-production, the work together, the co-production of care, healthcare, care at home, everything, and generates valuable health data, which alludes to business model possibilities in patient-controlled information flows, just stuff. So I want to this is my game plan for the next 10 minutes or so. So we're now on the top. We have this patient's world statement, the why. So I'm going to talk a bit about the patient-controlled information flows, the importance of learning networks in this world of healthcare. It's a already existing way to introduce new things and develop new things in healthcare, and biology of love to get us to the makerspace. Okay. So first, patient-controlled information flows. It was super. I was really amazed. I mean, when my daughter was 3, she also got asthma combined with this other lung condition. So how do we know what is asthma? How do we know what is mucus, cystic fibrosis? And we got this pen and this sheet of paper to make notes and collect data. So that was amazing. And I went to Google Health existed at that time, so I used the platform to visualize. And then I was also kind of started to think about, okay, there are some measures here that are like bridging boundaries. If I say FEV1 60%, it means something to me, it means something to the physician, it means something to the researcher. So there are these data points that really can help us understand. And then something else amazing happened, and this is very difficult to read, but it actually, when we had done some measurements for a while, all of a sudden, when I went to the pharmacy and I got the box of asthma meds, it says when you're gonna use this, when this blowing thing shows between 120 and 130. So the kind of thing, and that's a totally personal measure. It doesn't. It's kind of, it was just her measure, and all of a sudden, without saying, the physician had kind of listened to the data we had collected and actually even wrote it on the prescription. So that kind of, I thought that was really cool, and this was like 20 years ago. Since I was there hanging out with researchers, we wrote this paper on if we could have patient-reported outcome measures, and we did this statement as patient advocates, and it read like this: for most patients, there is no systematic or effective method for communicating what happens outside the clinical encounter, such as perceived needs, symptoms, response to treatment, undesirable side effects, effects on function, and what matters to patients and their families. Just like clinicians, patients want better outcomes for individuals and communities, and better professional development and system performance, although we might not use the same words to describe them. Patient-reported outcome systems have the potential to enable improvements by providing information that can bridge the gap between the clinical reality and the patient world, triggering learning as well as the right next action. PROM systems must be co-developed by patients, the public, the professionals to obtain maximum value. They should be integrated with the rest of the patient healthcare information, and patients should be able to use the information when and where they choose, including for research to benefit others with their condition. So this was 2015 in British Medical Journal. So that helped me kind of design this idea of the patient world arena and really be clear around the action arenas for data sharing, and it's this private domain thing. There is an exemption in GDPR because, of course, in our homes we should be able to write my neighbor is a crazy person without asking her. Of course, it's the domestic domain. So it's called the household exemption. GDPR doesn't apply there. So what if we could protect this private domain, which the legislators on the EU level have already for the last 20 years said, sorry, but all the business models destroy this private domain. There is no private domain because Alexa or Siri or they have other business models that destroy it. But if we could create something, a personal health information in the private domain, it could save us one day. Okay. Next, learning networks. So there is a cystic fibrosis is a really complex thing. It really affects your body, and every disease has their own course of illness. You know, it goes up or down. Or in cystic fibrosis, the scary thing is the exacerbations. When your lungs get infected, then you get sick, and then sometimes you get lung damage and you don't get back up, so you don't get back on track, and eventually that's what kills you. And the expected lifespan for a person with cystic fibrosis was 50 years just until recently, but there has come disease-modifying treatments, and this is something that happens in a lot of different disease areas. There is this shift from this decline to something else, and that changes the whole disease. So all the traditional outcome measures, everything we know about the disease changes, so that really brings the community together to learn new things. and when the community comes together to learn new things, it can look like this. This is the CF Foundation in Washington. People come together, work, design 120 people for months, develop all these improvement ideas. So this is what learning networks look like from the inside. So researchers, clinicians, patients, trying to co-design something around new situations. And then it comes in very handy if we can have a personal health information exchange that can integrate into different registry systems. So that's what we did. We connected this app system to different improvements. So I'm just going to give you a taste of, this is the lay of the land, normal. So thanks to, this is one person with cystic fibrosis for a year. So it's a lot of antibiotics. This is just antibiotics treatments. So different types of antibiotics, inhaled, IV treatments, oral pills. The IV treatments you get in a hospital, so the healthcare system knows everything about it, but the oral and inhaled, you do it at home, so healthcare doesn't really know. Before, this disease was so severe, so it didn't really matter. You bombard it with antibiotics, and but as this shift comes, there's a whole new need to understand what is it, what are the patterns. So we created a patient-reported system where you could maybe start scheduling IV treatments in new ways. Maybe you can see how the situations where you have to go from oral treatment to IV treatment gets fewer. You can find allergic reactions and start thinking more about those. A lot of the people with cystic fibrosis have poor hearing because some antibiotics really kill your hearing. So all these things that come up, and then of course the new hopes of living free and being injury free from your disease. So how could we start measure those? So that's examples. And when we started the coalition in Sweden for cystic fibrosis in 2016, a learning network mimicking the US ways of working in learning networks. And it's really strong when the physicians start trusting these systems. They say, like, if the patients start collecting this data, it has the potential for improving in many different ways. We can have more engaged patients, we can get exacerbations managed better, we can maybe prevent antibiotics resistance, we can understand baselines, we can follow up these new treatments, and we can report to the payers to show that our system really works well. So the kind of the use of these things are manifold, and we also learn that learning networks in themselves are healthy. They bring health. We see that when we co-assess, co-deliver, co-decide, co-design, we get better relationships, we get better satisfaction, we get better communication, we get better decisions, we get more effective treatments, and engagement and everything. So this is also in the British Medical Journal a few years later. Business model-wise, it's been showed that, and we've had income from all these different sources. You can support research, you can support benchmarking transparency in healthcare, you can support patient communities. There are a lot of different potential business sources of revenue for learning networks, for apps, and this is a blessing and a curse, as you know. But it's really cool. Next, biology of love. So of course the source of my entrepreneurial impulse comes very much from this idea of what human communication means, and I'm going to exemplify that. There at the entrance of the UN building, there's this poem that I use a lot right now, and it reads like this: human beings are members of a whole, in creation of one essence and soul. If one member is afflicted with pain, other members uneasy will remain. If you have no sympathy for human pain, the name of human you cannot retain. And I feel that you're with me. You can. The problem is not very often do we feel pain or can we feel pain. The problem is that it hurts, right? So how do we contain it, and how do we make something good out of it? So the Coca-Cola recipe for that is underlying here, that we developed with cultural biologists, is that we know that if we bring democratic principles of respect, equality, honesty, ethics, and collaboration down to the relationship between human beings, we know that that brings well-being and health. How do we do that? If we create shared learning, the sense of taking ethically adequate decisions and actions together, and we evaluate and learn, and we have these social conversations, that brings democracy. So how have we kind of translated this into what? Yeah, and this is something I did 14 years ago. So for the last 14 years, we've been exploring how can we create safe spaces for social conversations. How can we use these self-signified personal observations? So if we let human beings measure, but also tell us what does it mean. And then feedback, we all know of. The other really cool concept is feed forward. So if we can help people maybe only 5 minutes before the patient comes into the room, know who's coming in and what's most important to them, that shifts the whole relationship. Last. Okay, so we had the personal patient-controlled information flows, we have the learning networks, and we have the biology of love. And then how do we translate this? And there are many ways we've been working, but for this community here that we're starting to build, I was asked to just talk a bit about how we're working with a makerspace approach. And right now we have a research contract with Johns Hopkins in Washington that is connected to the whole center network for cystic fibrosis in the US. And it builds on these basic principles. Okay, how can we co-design? How can we really understand the user experience, not only from the interface or the tasks, but also from behaviors and how it connects to life. One important thing there is to really have something simple. So we have app is good, but we also need processes that we can translate and talk about and work on. And this is works. And then, of course, we come down to the stuff we're going to work on here. How can we create this personal health information exchange, work on the different challenges in transformation, understanding what data really means, and working together. So I would be happy to share these slides. But it all kind of sums up in this patient world arena model that we published. That the really cool thing, I think, and it connects back to the biology of love and these democratic principles. Like when I talk to a CTO at the big hospital in the US, they can, this is HIPAA golden, they say. I mean, here everything, there is no, because everything loves this. What is everything for? EU is for peace and democracy. GDPR is to protect the individual. We all need to collaborate. So kind of, and the struggle is, of course, that a lot of our legacy systems were not developed this way. But but I find it that everywhere I go, when I as a lawyer sit down and start this way, it really gives people hope. Thank you.